everyone, welcome to the last video in this mini-series of things to know before you get pregnant. This one's for strengthening. So if you're preparing for the athletic event of labor and delivery, there are some things to address beforehand. And while pelvis and pelvic floor mobility are crucial to let that baby out, strengthening prior and throughout pregnancy can help to make the journey smooth and the recovery process even faster. The average labor lasts 8 to 24 hours, so you are preparing for a marathon and not a sprint. And starting an exercise program prior to pregnancy will give you a solid foundation before all of the changes that come within pregnancy and the endurance to tolerate the different stages of labor. A well-balanced program will address all aspects of the body above and below the area of involvement. And if you're new to exercise, I would always recommend seeking the guidance of someone to advise you on a program that's specific to your daily and recreational needs. So first, we want to address hip strength and stability. Balance around the pelvis will allow for better movement tolerance and decreased load on the spine and the pelvic floor. This can be things from bridges, hip thrusts, hip hikes, single leg RDLs, or hip airplanes. Single leg or split stance activities are going to be preferable because they will help to maintain pelvis mobility and decrease any imbalances you may have from side to side, which is crucial to provide enough mobility for the baby to pass through the pelvis. You're going to want to focus on slow and controlled movement to notice any compensations or differences from side to side. The second, we want to address your pelvic floor coordination with lifting, carrying, and impact. It's important to avoid gripping and decreasing muscle length, as we tend to think of strength and pelvic floor during pregnancy, but having the full range and mobility is going to be what lets the baby out and creates less of a barrier during labor and decreases your likelihood of stalling. A strong muscle can move through the complete range of motion, and during pregnancy, you'll want to be able to practice the relaxation of these muscles with upper abdominal contraction for good pushing mechanics during labor. If you feel like you don't have good awareness of that, that can be facilitated by a pelvic floor PT who's trained in internal mobilization, and biofeedback can be another helpful tool as well. Third thing is core strengthening. This will help to decrease any amount of abdominal or round ligament pain, back pain, or hip pain throughout pregnancy. This can be things as simple as laying on your back, engaging and marching while keeping your spine stable. You can do that in standing, straight leg raises, balancing activities, or you can incorporate even more dynamic stuff like Bosu ball squats and weighted carries. Those are all things that I incorporate frequently into people's programming, and some of those will be too easy for some individuals and too difficult for others. So you want to be able to focus on things that keep spinal control and decrease any amount of abdominal doming, or that contribute to that anterior pelvic tilt posture that occurs in pregnancy. So if we think of how long labor lasts, 8 to 24 hours, we're going to be targeting more of your endurance repetition ranges. If you're new to strength training or exercise, you might want to start with a lower repetition range and build a strength foundation first before you progress to endurance. You should feel a moderate sense of fatigue by the end of the set and be pretty darn tired by the end of the third set. So we'd start working with 3 sets of 10 repetitions and work towards 3 sets of 15 to 20 repetitions with 30 seconds to a minute of rest in between sets. Now, connective tissue takes 6 to 8 weeks for you to see true strength changes, but within those first 2 to 4 weeks, you will feel much stronger as your brain becomes more comfortable with the movement pattern. If you increase your weight too rapidly, this is where we run the risk of muscle or tendon strains. So what I do is if I can add 2 repetitions to the end of every set, I will progress 5 to 10 pounds with upper body and 10 to 20 pounds with lower body. I will not do this faster than every 2 weeks. If you increase your weight and you cannot maintain your form or control, you need to go back down and increase your repetitions as you're able. Specific intervention is always going to be the key here. So the program should be tailored to your history, your athletic demands, and what our goals or imbalances are. So always discuss things with your providers. Again, thanks for listening and stay tuned for our next mini-series.